our headache program, we always want to focus on giving the children and adolescents sort of goals that we have for managing their headaches due to migraine. And so one is we want their acute treatment to work 10 times out of 10 within an hour, and so they can return back to normal. And their preventive therapy to reduce their headache frequency to less than one a week. So putting those as sort of metrics that we want to include, there are certain things we do recommend in terms of leading that forward. One of the things that is essential in part of that is the healthy habits we discuss, which is really, as we discuss with children and adolescents, that migraine is the disease, not the event. Headaches are the events. And so they have a genetic disease. And by using and managing healthy habits, eating, drinking, sleeping, and exercise, keeping their body basically physically healthy, that can be the biggest factor, can help move it forward. Saying those goals then of getting 10 times out of 10 within an hour in every child we see, or headaches less than one per week, we're not there yet. So that does mean there are gaps to be filled, both gaps in how to determine the studies, as well as probably the wide polygenic nature of migraine itself. There are new agents being tested and proven for adults, including the gepants and the dietins that are just beginning to be looked at in children and adolescents. We don't know yet how well those work or how well they'll be tolerated, but those studies have been initiated, as well as new agents we probably will hear about this Congress that are in the development stage. From a prevention perspective, there are quite a few gaps also. Fortunately, there are agents such as the CGRP antibodies, as well as the gepants that are under investigation, as well as devices both for acute and preventive treatment that may be useful that we need to be looked at. So the future is bright in terms of opportunities, as long as things are done correctly in terms of managing the studies.